Our next speaker is Krishna Prasad sir. He's going to tell us how to inspire beyond the post-graduation.
You're not going to tell us about Broca's area today?
It will come.
If you don't know, Dr. KP's IC on Broca's area is an all-time favorite and nobody can strike out of that IC. So every chairperson scientific committee has the Broca's area IC in place.
Thank you, sir. Thanks for my inclusion. It's always nice to be in this teachers' conclave. This is a topic which probably means, according to me, is that postgraduate training, getting the degrees, everybody's job here, and can we go beyond that? It is just that we give them a degree. So many a times it happens that it's actually a very sorry state of affairs in our country that many of the postgraduates, sorry for making it so blunt, that really do not deserve the degree they get. It's all because of us. Because we have a policy that we will not teach you, we will not fail you. Right? That suits it well. So I have been witnessed this the kind of batch of students who are coming out from across the country. I'm fortunate to actually interact with all of them as my short-term trainees or my fellowship candidates. It's actually very sorry that we need to understand that we have to really make them, employable, make them really deserve the degree they do. Probably that is what this means and how we can actually do a hand-holding. So how many teachers of your life you remember now? I remember somebody who taught me in my 4th standard, but I still have forgotten many in my BBS days. So probably why do we remember a particular teacher? Is it because they taught some important subject or they taught very well? May not be. So basically if you just look at a postgraduate student, let's say my student, what are the ingredients of their success in their life, professional life, let's say? The knowledge and the skills that we impart and the attitude that they probably wear it on their sleeve. See, knowledge, obviously now we have so much information. We just heard that there is a plethora of things that we can do. Time is too short. 3 years is too less now for the kind of things that we need to learn in ophthalmology today. So earlier there was actually ENT in ophthalmology as one postgraduate subject, long back. Now we don't have even 3 years is not enough now. Okay. And basically is it that, what is the main purpose of getting a knowledge? That is very important. Like, is it to pass the exam or is it really treat a patient? So that's where Dr. Santosh said, like if it's a problem-based learning, see the basic problem of our evaluation itself is, like we normally give a question in the exam like the etiopathogenesis investigation management of, let's say, ocular sarcoidosis. People read up and come but in practice, in real life, no patient comes, they say I'm ocular sarcoidosis. So we need to do a reverse engineering. Ideally our topics should be not ocular sarcoidosis. Somebody like, the topics should be like a patient who just lost vision a minute ago, patient who has 1 week vision loss, patient who lost vision 1 year ago. So this should be the chapter, like this is how the patients come. So basically how do we learn from this and extrapolate to the real life is only possible by the innovations that we can probably do. And obviously the knowledge that we give has to be relevant and contemporary. Still we have teachers teaching things which we don't really practice. Okay, and it should be usable, practical, and also this is only by interacting with mentors and stalwarts. So we really know what is the cutting edge thing that we do today. So a lot of, especially medical colleges are away from the cutting edge technology, so they may still lose out on that. So constant upgrading and updating. Well, skills are observational skills. You need to look at your mentor and your teacher to understand things, and surgical skills you need to learn hands-on. Your muscle memory you need to get, and the diagnostic and clinical skills, procedural skills, and very importantly Dr. Kirti's passion, that is communication and soft skills. This probably completes the picture, and also the exam skills or the writing skills. So that's how, by basically how do you actually inspire beyond is basically, are you, like who are your role models of your postgraduates? Are you the role model? And basically we have a OSEX where we watch a student and try to understand how they do it, evaluate it. Should be the other way around. Your student should sit behind you and see you in action. Like how you actually counsel a patient, how do resolve a crisis? How do you know conflict resolution? Or if there's a patient is telling something and you think that is not the way, how do you actually come in between? So basically, how you solve the day-to-day problems and still end up treating the patient successfully. And obviously, over observation is very important. And surgical skills, I'll not go much on that. I mean, there is a lot that we need to do. And very importantly, so this is the cornerstone. So if you really want to make my student really successful in life beyond his post-graduation, he has to learn to talk. We do not have a curriculum in MBBS. There is no exam for your counseling or communication. You are not given a patient, say you counsel him and give him marks. Nobody does it. So it's only innate, our own trait that actually helps somebody to become a better communicator. So it's only that we have spent a lot of years, we have fine-tuned and curated our communication. So it's only by copy-paste in the beginning. And Broca's area is here, sir. So you watch, rehearse, emulate, enact. That is where we actually do dry runs. The patient actually does a counseling, like you give a situation and patient has to counsel. For example, a simple thing, like I say, patient comes and says, sir, it's a day-to-day thing. No, patient said, which eyeball, okay, I should have, you tell me. Most PGs can't answer this. Okay, see, this is how we need to actually do things, and definitely breaking bad news, counseling cataract patient. This is something very important in prognostication. So, basically the idea is to make a novice into an expert. That is your job, a tough job that you need to do as a teacher. But what is basically like, we have a lot of lectures in postgraduate, undergraduate. From morning till night you have anatomy, physiology, medicine, surgery, lectures. But once they shift to PG, like all lectures we'll see, it's only students presenting seminars or journal clubs and things like that. It is no more a faculty lectures are very rare. So basically this is where how can a student teach something where you have learned so much over years? So you need to actually give the eminence-based medicine. People have enough information. Okay, you tell something, they will Google it, they have a lot of information. But you need to really say, this is the right information. Most of it is actually junk. And the methodology abruptly shifts, it's on the student for him. Okay, then you are not really teaching anything. And PG is not about teaching. It's about mentoring. So you are mentoring somebody. So mentoring comes with a lot of baggage. Okay, that is where you kind of inspire them. And it is about art. The science is already there, you are already doing it, but there is so much art in a post-graduation because you are going to become a specialist. It's not like an undergraduate where you are a little detached from what's happening in your clinics. You basically need to learn the trick of trade and go and practice there. So you need to learn the ingredient of art. That's very important. And as I told you in the very beginning, what is the one single most important word that decides how good is your training? It's our employability. After your PG training, can the student be hired for a good sum of money? Or institution lining up to hire the student as a consultant? Most students are not employable. So that is a slap on our face, on our system, that we are not making a student. So they need to really go through another rigorous lot of years of fellowship training and trying to learn the skills, and they end up learning things in fellowship what they should have learned in post-graduation. That's a sheer waste of time. So that is where we need to do. Okay, we have 2 minutes, or it's already 2 minutes. Okay. So how to inspire this last 2 minutes? So basically, you become a role model yourself. So basically, it is that. No, I told you in the beginning. You remember your teachers for your non-teaching attributes. The student, you never remember for their teaching skills. Okay. So honesty of intention. Like if you are honest, if you are non-corrupt, and if you really speak your mind, and if you really walk the talk, because students are watching. See, when you are a teacher, when you have students behind you, please be genuine, be transparent, be honest. For God's sake, because they are watching you, they are very opinionated. They can make judgments, and they basically need to orient their communication and soft skills. And finally, the human character. I told you that's something very important. And please understand that you have the authority in you. You can really put all your sadistic traits onto them. You can really make their life miserable. You can be very unreasonable because you wield so much power only for a short 3 years. Okay, later they will loathe at you, no? Basically, most importantly. So please think that PG training, that period, they are not your slaves. And that is not everything. Their life is more important. Okay, they need have so many other priorities other than getting just a degree, and you are not God for them. Okay, so basically, you need to collaborate and continue to inspire in your life. That is very important. Finally, so be a friend, no? So I don't just get into their shoes. I just wear my shoes and play with them. We have every week, every alternative. I play, badminton, cricket with them. So basically, when you take time out of your clinics, out of your workplace, I need get to understand their life. I need to understand their fears, their problems, and their priorities in life. So that is where you connect at a human level, and I can actually be a better teacher if I understand their wholesome, the profile and personal life guidance. I am known for giving marriage advice, counseling about having kids, counseling about professional thing. I'm out of what is not my passion. Teaching ophthalmology is my role, but we really cross the line, so that because with my whatever little wisdom, I can definitely help. It has worked actually, and that is why some of the teachers, some of the students are still remember me even after so many years, even though I'm not a great teacher. So do it unconditionally. Don't expect something from anybody. So please do it unconditionally. I always have told this. My teachers have done a lot to me. What I am today is because of my teachers. So the only way to repay them back, I can't repay them back. The only way I can do is to probably, pass it forward. So basically I can just pass it forward to the next generation and teach them unconditionally. Be a good human being and teach them unconditionally, so I can slightly repay my teachers. So that is what it is, and taking pride of their achievements will finally end it all. So this is how you continue to be a good human being, maybe a good teacher, but definitely you will be an inspirational personality that they will remember for years to come. Thank you so much.
Thank you, sir, for covering each and every aspect. And I am lucky that I played with you once a time. Now we have our eminent panelist, Dr. Anurag sir. Your take home on this, how to inspire your PGs or the fellows.
You come here only.
Mic to there is
You like to stand tall, Anurag, so you can be on your feet as well.
He's very much inspired by Himanshu. Voice motivation and all nowadays.
I don't know, I'm actually not changed into the professional formal attire, went for life surgery and came running amok. I don't know what my take-home message from this would be, because I never was a teacher and nor do I qualify to teach anyone. But just one question I had for you, sir. I mean, if that qualifies to be a comment, a legit comment from a panelist. What if you see one of your students about to overtake you in anything? What if you see your student better than you in communication skills already, in terms of vocabulary, in terms of language sense, in terms of articulation? What if you see that person already naturally talented to be a better surgeon than you are? I mean, through you.
So what Anurag is asking is, if he was your student, what would you do to him? Or what would you do to yourself?
Other than asking me to bang my head against a rock, what would you advise to the, because this is a very practical situation. I know it has a color of humor in here, but this is a very practical situation. The trainers do get such students at times in life. And when you have a generation gap, the young generation always takes less time to be an expert in something. So what would your advice to the trainer be? Should they come across a soul who is supposed to be or is all set to overtake them in anything in life?
Let's start with Sanskrit. There's a phrase called Shishyadik Parajayam. That means the best tribute for a teacher is to be defeated by his own student, like Dronacharya. Okay? See, the greatest tribute to Dronacharya is Arjuna defeated him. So if I can create somebody, okay, who can defeat me, okay, it doesn't mean that the Guru knows everything. See, that we are going with the presumption that the Guru is the ultimate authority and he cannot be defeated, and a student defeating him would be a no. Student, see, basically, and the guru need not be the best in that art. Guru is just a trainer. Guru is a coach. Okay, have you heard of Mr. Achrekar, who trained Tendulkar? Achrekar is not a great cricket player. He was not a great batsman. But he was one of the finest coaches. So basically, please do not really get into this game of comparing yourself with your previous student. Okay? See, I am not a great cataract surgeon, but my students definitely are better. Okay, that's actually, I can always take a small, pride in actually coaching them at some point of time. At the same time, not all students' achievements are attributable to your efforts. Okay, that is one more thing. You should not be undeservingly trying to take the credit. People are grateful to you, but you should understand the reality. I never did much. Okay, so that is also there. A humility of this befits a guru. That's very important. So teacher, like we say guru is something different from a teacher, because guru is an all-encompassing word.
Can I answer that in one line?
Yes, yes.
Beautiful, KP, Sanskrit. There's something called as a banyan tree culture and there's something called as a banana tree culture. Banana tree, some Hindi, बरगद के नीचे कभी कोई पनपता नहीं है. Therefore, banyan is not worshipped. People is worshipped in Indian mythology. Banana tree culture is very popular in Japan, where banana tree only flowers once in a lifetime and then gives 7-8 daughter shoots, and then they give granddaughter shoots. It never flowers more than once. But that creates things. So a teacher is just the person who is privileged to teach. He, in fact, अगर teacher से शिष्य बड़ा नहीं होगा तो evolution कहाँ से होगी? What have you done if you haven't bloody made your student better than you? You should. It's an honor to a teacher, and that's how we should take it. That is our purpose of teaching.
Dr. Rekha ma'am.
Doel is here, and Doel is also a very, very favorite teacher, as well as she has a great ability to get on to the audience whenever she is speaking. So Doel, you have not spoken much in this whole session, so one comment for each one of them. Start with Amit.
Give him mic.
One sentence per speaker.
For once, I'm not going to listen to you, Parthoda, because what I'm going to say is about you. Parthoda has been my mentor when I started with refractive surgery. More than a mentor, he's been my panic button. Every time something happens, I ring him up. Parthoda, I'm in this mess, get me out of it. And he does. But there's one anecdote I would like to share. There was this patient, I had done a LASIK surgery. Patient turned up with a stria in the flap, and her vision was low, and I called up Parthoda. He said, you have to lift the flap and you have whatever had to be done. I had never done it before. Early part of my career, I panicked and I sent the patient over to him and I told him, Parthoda, deal with the patient. I cannot deal with her. Parthoda rang me up and said, you are going to deal with that patient. I will come, you will do it in your OT. We don't work in the same institute. I'm at Schustruth, he's in private practice. He said, I'm going to come into your OT, stand by your side, you are going to do it. Luckily, we didn't have to go through that because the patient cleared up somehow or the other. But that is a lesson that I have learned and I practice now when I am teaching my my colleagues and my juniors refractive surgery. Sometimes, when they are struggling to lift the flap or something, it's so tempting to tell them, move aside, I'll do it, But then I remember that, when my turn came, he was patient enough and he didn't take my patient away from me. So I'm, as they say, passing on what he has taught me.
You were asked to comment on the speakers.
I'll comment. One thing I have against Parthoda is the favoritism he shows this guy. He walked in late, he knew nothing about what was going on. Moment he walked in, you asked him to give his comment. What? Parthoda, I protest, and you've done this, you do this repeatedly. This is not the first time. This is not the first time.
This is what you get for reminding a so-called teacher of her job.